With the full support of my organisation, I applied and I managed to convince the Health Foundation to allow me to go on a Quality Improvement Fellowship to Boston, and the year was transformational.
Their motivation is obviously to champion quality improvement in healthcare in the UK. They want to build a cohort of people who have the technical and personal skills to lead quality improvement at a senior level and potentially at a national level.
It completely changed my view of healthcare. Reflecting back now, I see I almost went through a grief reaction. I started to learn things that I became angry that I'd been a doctor at that point for 16 years and hadn't been taught any of these things. The use of data, the use of patient story, the use of time series, statistical process control. I learned so much so quickly.
I've already started using the learning from our first session back in November. It's made me reflect on how I'm doing my day job here at Sheffield Teaching Hospitals and making suggestions for how I might change what I do to be more effective and be more influential.
Perhaps a unique benefit as an NHS consultant of the fellowship year is the opportunity for reflection, a year with time away from clinical duties, with the space to emerge concepts gradually, reflect them back on your own home organisation.
It's giving me the opportunity to really reflect on who I am and what I'm good at and how I can be better, both sort of professionally in my job leading quality improvement, but also kind of using the team around me, how I can use their skills more effectively.
Fresh eyes is an amazingly powerful tool. So I returned and, having been trained in systems, saw my own system differently.
We created a post for him which was part-time clinical and part-time service improvement. And since then he has been instrumental in a number of areas regarding improvement and also patient safety.
If the doctors can help at all with that, if on that first patient, does it mean one of us getting in the ambulance with you, for instance? If there's some way we can help offset the safety feeling of that first patient. Understanding the systems of my own directorate of geriatric medicine, measuring it, process mapping it, that was part of the first year back from the fellowship. I remember the last piece of advice that Don Berwick and Maureen Bassanio gave to the fellows in my year before we returned. They said, "We've loaded your backpack full of knowledge and information for the NHI. Whatever you do, when you return to your home organisation, don't walk in and throw the backpack on the table. Just wait. Wait for people to ask for things and then look around in your backpack and get them out." 18 months back from my fellowship year, I'm still doing that. It was incredibly important advice.
Not only is he contributing at the system level, but he's also contributing probably more significantly in the education and training and development of others, which I think in the longer term will create a much greater awareness within the organisation and also a cohort of colleagues who have A, an understanding and B, a methodology to follow.
I think the fellows come back with a very, very, very unique skill set, but one of the advantages is it's a small group of fellows. There aren't many of them around, but the network that they actually create and the ability to draw in others is incredible.
I think you've got to be a good communicator. I think the people on the programme are wanting to understand how they can be better at communicating and engaging others in the work they do, as well as acquiring the technical quality improvement skills that I believe the programme's going to give us. But I think it's about people management, and a lot of what quality improvement is about is around behavioural change, so getting better at how to engage with others to affect that change.